Who trusts the government, you know? Nobody. They're lying to us. Our children are probably going to die of cancer 20 years from now. My throat's still sore. I woke up with a bad headache. You know, I'm old, but our kids.
The report shows the test, everything is okay right now.
I don't believe it.
I don't believe it.
My brother had a meter and he went to the house and it was not. They moved. They went to South Carolina.
I'm sorry. But what is so sad is our property, nobody's going to want to buy it because we've got a stigma now. And that's just, it's terrible. But this is our home. I'm not leaving.
So the EPA is providing monitoring and stationary sampling data. The monitoring data is from these handheld monitors that are really not designed to measure outside air quality. I believe these are also the instruments they're using to screen people's homes and let people know that it's safe to move back. As an atmospheric measurement person, I would not feel comfortable with that level of screening. And so when people are reporting smells, you know that there are still chemicals that are present in that environment that were not there before. By the EPA's definition, would require air sampling, which means you take air into a stainless steel container, you take that back to a lab, and you do much more detailed measurements and characterization of what chemicals are present and at what concentrations. If it was on the floor, if it was a toy, it was in their mouth, I'd be really concerned about indoor surfaces and base. And so especially with young children who are touching everything, we know that kids are more vulnerable to chemical exposures. There's just so many more ways that these types of chemicals can get into their bodies.